Doctor, thank you so much for joining us. Of course, healthcare is overwhelmed during this festive season due to increased emergencies. How would you describe, trauma cases during the festive season compared to the rest of the year?
I would say this year we have not seen as many trauma cases as compared to last year, where in the month of December alone we saw about more than 450 cases of trauma recorded at our emergency department. And this year, for the past 1 week, we have seen so far 59 cases.
I mean, it's festive season. We get overly excited. We overdrink. We overeat. This ultimately leads to, illnesses, violent altercations, also accidents. So, what would you attribute these trauma cases to?
Most of the time, people are in a happy mode and they are enjoying, they are drinking a lot of alcohol, and most of the fights also erupt in the locations there, and they are rushed to our casualty. They stab each other with knives, and we have also reported incidents of drowning and near drowning, where people get drunk while they are also playing in the water.
And what about accidents? Because I know we did speak to the traffic commander, recently, and he did mention that the traffic was quite slow. We didn't record much accidents, but have you seen any incidents, traumatic incidents as a result of car accidents?
Accidents have been reported, and a number of casualties have been brought to our emergency care, coming especially the road between Usakos and Swakopmund. So a number of accidents reported there, with few casualties brought to our emergency department this festive season, not really sustaining major injuries. So.
Another matter of concern is that the Namibian Blood Transfusion Service is running low on blood donations. Is Swakopmund sufficiently covered in that regard? And how does, when you're running low on blood, the less stock of blood, ultimately affect operations of doctors and nurses? What pressure does that put on you?
Blood transfusion services is key in providing life-saving care during festive season, especially to Swakop, where everybody want to come this side, and we see a lot of car accidents and patients that come brought here having bled a lot, and therefore the blood transfusion service is very important, and it relies heavily on generous donations of donors. And we really encourage that people out there should donate their blood that can be used to save lives during these festive seasons.
Doctor, just before we let you go, a high number of patients also means, some patients will not be accommodated or treated very well due to that demand. Are you ready to accommodate these emergencies?
We put up measures to make sure that the staff, hospital staff, are available to render the emergency services that are needed, and also to try to equip ourselves with our theater staff, our surgeons, and our laboratories, so that we are able to respond quickly to emergency cases that are required during that time.
New Year's Eve is still upcoming. Any message to those, especially who have underlying health issues?
Just to advise them, take care of yourself, don't be drunk, and be near the water, and drive safely, and take precautionary measures when you are enjoying this festive season, especially during the New Year celebration evening. Please don't be overly excited and indulge in health risk behaviors. Take care of yourself.
Well, Doctor, thank you so much for joining us tonight. Well, there you had it, Dr. David Tjiyokola, just giving you guys some advice. Do enjoy this festive season responsibly and do take care of yourselves. Back to you in studio.